about a state-of-the-art clinic opening that was disrupted just yesterday by a local community who are up in arms about a lack of service delivery, specifically in the health sector as well. We heard from the Health and Allied Workers in Indaba Trade Union, who said they had to step in to play peacemaker between the community and government. But let's hear now from the Health Department itself. Gauteng Health spokesperson Motalatala Modiba joins us via Zoom from Pretoria. Motalatala, thank you so much for your time this evening. You would have heard the views of the Health and Allied Workers in Indaba Trade Union. I'm sure you would have heard the views of the community on the ground at the opening of that clinic that was disrupted yesterday. There is a statement that the Health Department has sent out saying that it was unfortunate that there was an attempt by some community members in Zone 16 to hold up the opening of this clinic. But by the sounds of it, it's quite a complex matter. It's both about ongoing issues with the lack of service delivery in that area, but also it sounds like there are promises that were made to the local community in who would be provided with work opportunities at this new clinic that they say did not come to fruition. What is the Health Department's stance on that specific claim with regards to job opportunities at this new facility?
Thank you for affording us the opportunity. There's no truth to that particular claim. I think the jobs that they're talking about has got to do with expanded public works program, which were not necessarily in the purview of the Gauteng Department of Health. We are well aware of that, and I think our sister department did intervene in that particular area. The issues that the communities there had raised, fortunately we've been there for the whole week engaging with communities there, are not really about health services in the community. They are service delivery related issues, the issues of road infrastructure, issues of your lighting in the streets, issues of, there's a number of service delivery related issues which in our engagements with communities were clearly raised to say, while those issues are legitimate, it's important that we don't deny people that should be having access to health services through this particular clinic a chance for them to get those particular services, because maybe we still have other service related issues that are unresolved, and already the provincial government has committed to work with the particular communities. If you have noticed, almost every second week, there are programs that are unfolding in the whole of Sidibeng, which are led by the provincial government to intervene in various service delivery related issues. And the MEC yesterday, by the way, did actually engage with the communities to listen to them, to hear what their concerns are. And she did actually also commit that the issues that the community are raising are actually issues that are on the agenda of the Gauteng provincial government. And therefore, there shouldn't be a reason why a clinic that they have waited so long for could not open. If you were to go to Zone 17, to Sebokeng Zone 17, and you see the current clinic that communities have been receiving services from, you would not want to go there and receive services yourselves. I've been into that clinic myself. I mean, it's not a place that we should be providing services for communities at, and hence, in the very same yard where the clinic is, a new facility was built so that the communities can actually, because there was an outcry from the very same community to say, we can no longer accept to receive services in an infrastructure that we currently have. We need a better infrastructure. And indeed, a state-of-the-art facility has been delivered now. And now it seems like there are other service delivery related issues which have little to do with health services, which communities are saying we also want those to be addressed. And we're saying those issues do not necessarily have to be a condition upon which the clinic operates. The clinic must be able to operate to continue to provide services, while at the same time, the other related issues are also being addressed, because it's not either or. You still need to have people. There are people there. I mean, if you look at the clinic in terms of the population that it services, over 70% of the population there would not afford private medical care. So by closing the clinic or preventing those communities to actually access services, you're actually endangering the lives of others, and you can still raise genuine issues in terms of the other service delivery issues, but don't hinder the rendering of services, because actually so we're not saying the issue that the community are raising are not genuine, but we're saying I don't think it's right that you would then prevent those that require health care, because it's their right to actually access healthcare services.
Motalatala, and I'm sure many people would take that on board, but it does also sound that you're acknowledging the frustrations of the local communities. There were ever claims that there were tensions between the local communities and healthcare workers who were working in the old dilapidated clinic before that, and that comes out of frustrations that there weren't enough resources, that building had been allowed to become quite dilapidated even long before the building started on this new clinic, and the trade union was saying that that's something that they needed to try and intervene between their members who are healthcare workers and the community. And they're saying, and as much as this clinic is beautiful and state-of-the-art, they say it's too little too late, that even this clinic won't be big enough to service the large and growing population in the area, and that they need more. What is your response to that?
That clinic is not the only clinic that actually provides services. Remember that when
apparently
we build
there
the
are two
facility,
24-hour
usually,
clinics in that area, from what I understand. There are two, from what I understand.
yeah, the current clinic is not a 24-hour facility, the one that the Zone 17 clinic. But obviously, in terms of plans going forward, there are plans to look at that, to say, now that we've got a proper facility, how do we then work with communities there, obviously, to eventually be able to provide services on a 24-hour basis. You would know that currently in the clinic, we've got about 46 employees that are working at the clinic. And in terms of the new structure that has been put in place, we will require about 92 employees to actually work at that particular clinic. So as we incrementally increase the capacity in terms of health workers that are working there, we obviously also need to then look at the operational hours. But I don't think that we need to say until the clinic maybe operates 24 hours, we have to block the services. It's still a good facility that should still be accessible to community members. And the good thing is that we have not shied away from the issues that community members are raising, even the issues that are being raised by unions on site. We know that there are security-related issues, and that's why it's important that we foster better relations with communities around, to say, this is your facility, safeguard it, because it doesn't help to put the lives of healthcare workers at risk because you are unhappy about the quality of maybe your streets. Those are your community members. They reside in the very same communities. Let's allow them to render services while at the same time addressing the other service delivery issues. I think the point that we must emphasize is that no one is saying the issues that communities are raising are not legitimate. There is legitimacy to the issues that the communities are raising. But I don't think we need to say we stop all other services because we're looking for access to a particular service. We could still advocate to have access to that particular service while at the same time enjoying this first-class facility.
Motalatala, before I let you go, I just want to get some clarity on an issue that we raised right at the start of this interview around what the community say were promised jobs through the EPWP, the Extended Public Works Program. You did say that you were aware of it, but that is something that falls within the realms of a different department. What are the next steps, though, in that regard? And as much as it's not within your department, it is something that is part of the issue that's blocking the opening of this clinic. Is your department committed to ensuring that the issues around what was promised by the EPWP programs will be cleared up? Because the trade union said they just wanted the communities to be engaged in what the plans were with this department, who would be employed there and what the projects were going forward. Unfortunately, it seems we've lost our Gauteng health spokesperson.